Good afternoon. I'd like to call the Health and Human Services and Aging Committee to order. Today is Wednesday, November 19th, and it's 5 minutes after 1. Madam Clerk, can we have a roll call, please?
As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Mr. Castleberry.
Here.
Mr. Hauser.
Here.
Mr. Schlepper.
Here.
You have a quorum.
Right. Anyone signed in for public comment today?
No, Madam Chair, no one has signed in.
Right. Approval of the minutes from the November 5th. Can I have a motion, please?
Second.
Moved by Sweeney, seconded by Castleberry. All in favor, please say aye.
Aye.
Thank you. We have several matters referred to the committee today. The first item we will skip because the lady is coming in traffic. And so, Madam Clerk, if you could read the next item into the record, please.
Resolution 2025-0323, authorizing an agreement with Cuyahoga County Prosecutor's Office in the amount not to exceed $8,322,252 for legal services for the period January 1st, 2026 through December 31st, 2027.
All right, before we get into that, Director or Administrator Merriman, can you please give us any updates on any of the SNAP partial payments?
Oh, happy to. David Merriman here on behalf of the Department of Health and Human Services. Thank you for asking. I think as the Council is very well aware and have been very active in monitoring the impact of the government shutdown, the government was reopened, which was great news, and also that we have been able to begin to see payments on SNAP occur. For those of you that have tracked this, there was initially a commitment to do partial payments, and that was done by the state of Ohio. They actually worked on it over Veterans Day, and partial payments were begun. Shortly after that, the federal government made the decision to begin doing full payments, which in essence created a little bit of confusion for the public because some people had already gotten a partial payment, some were still expecting to get a full payment. So what I just want to share is that we expect we're hearing from the state of Ohio to expect that all partial payments will be made whole by Friday. So individuals that got a partial payment should get the balance of their payments by Friday. And anyone that was scheduled to get a full payment maybe Thursday or Friday of this week may actually get the full payment. There has been some confusion. Some residents have gotten amounts that don't make sense. They've been reaching out to us. I know that Kevin Gowan and the Job and Family Service team have gotten a lot of calls on Monday. They had a very, very high traffic on their phone system, but we're managing those calls, and Tuesday was better, and we're hoping that today will be better. So appreciate you tracking it and following it along. We're going to do our part. As you know, this is a state of Ohio responsibility. It's their contract, it's their service that ultimately determines when people get the funds. But just happy to provide you with that update.
Any questions from my colleagues?
All right, thank you. So I think there are two items before you today. I'm going to ask Marcos Cortez to come up. The first item is our reoccurring contract with the County Prosecutor's Office, a team that is located in the Jane Anna Hunter building, as well as some of our other buildings that work directly with our child and family service team. And so that is first. I think our second one is going to be the options program. I do know that Director Jackie Fletcher is out this week. So I know that there will be leadership from the Division of Children and Family Services presenting the first item, and then Natasha Patricola is here for the options contract. So I think both of these contracts are ready to go.
Good afternoon. Marcos Cortez with Health and Human Services on behalf of Children and Family Services. Under this agreement, the prosecutor's office will provide custody representation, general civil representation, appeals representation, and parent-relative locator services for DCFS. Some of the tasks include drafts of all complaints, draft necessary motions, pleadings, affidavits, appear at every court hearing in with the county prosecutor's office, prepare county prosecutor's office experts and other witnesses for testimony, provide 24/7 on-call representation, handle records, subpoenas in juvenile court, brief and argue all appeals and agency cases, and consult with Children and Family Services staff when families are evasive. This agreement is for another 2 years. We do have Cara Davis with Children and Family Services here, and Laura Brewster from the Prosecutor's Office, who can answer any specific questions related to the program.
So is it being amended?
No, this
to
is a new 2-year contract.
And why we're doing two? Does it have the option for the third year like most of our other contracts?
I believe we've always done 2 years with this one. I think it coincides with the budget.
All right, has the price or the cost went up in any way?
This cost is the same as the previous 2 years.
He does a good job.
Any questions for the employees or staff that came from DCFS? Okay. Seeing none, hearing none. Would you, this is 1/1/2026, 3 readings good, or?
3 readings should be fine.
I'll make a motion to move R2025-0323 to the full council under second reading.
Second.
By Conwell, seconded by Schlepper. All in favor, please say aye.
Aye.
All right, Madam Clerk, can we read the third item into the record?
Resolution 2025-0324, authorizing an amendment to a master contract with various providers for Cuyahoga Options for Independent Living Services Program for the period January 1st, 2024 through December 31st, 2026, to extend the time period to March 31st, 2027, to change the name of 2 providers, and for additional funds in the total amount not to exceed $7,237,500, effective upon signature of all parties.
Marcos Cortez again. Again, this is an amendment to a master contract for the options program. This amendment will add funding and extend the time period through 3/31/2027. The options program provides in-home services to seniors and adults with disabilities living in Cuyahoga County who need assistance with larger household chores, medical emergency response services, grab bar installation, homemaking assistance, home-delivered meals, and personal care, and/or transportation for medical-related appointments. The overall goal of the options program is to extend the amount of time a client is able to reside in a home before requiring more intensive services. We do have Director Natasha Petricola here from the Division of Senior and Adult Services who can answer any specific program-related questions.
All right, Marcos, additional funds in the amount. Okay, so what was the cost last cycle? Has it went up, increased?
Yes, option has definitely been given additional funding.
And how much is that additional?
I don't have the exact figure in front of me. I believe we've amended it a couple of times to add additional funding.
And when is the next RFP?
Next year, we'll issue an RFP. So beginning April 1st, 2027 would be a new cycle.
Any questions for Marcos, from my colleague?
Madam Chair,
Yes, Councilman.
thank you, Marcus. I saw change the name of the 2 providers, so what was the change for the providers? Or new providers, or name change of the operator? I wasn't following that.
I'm pretty sure we didn't add any new providers. I believe if, like, on occasion, different agencies buy out providers, and so we have to do name changes, or if we inadvertently had the wrong, like if it was like LLC, DBA, so those could be the changes. I'm not 100% sure about these 2 providers, but I can look into it for you.
Okay, thank you. And I guess my point is too, it's not from them not providing a lack of service or anything. It could just, like you said, somebody bought them out, or maybe a change in name or direction, but they're still providing the needed services.
Tasha might have more information.
Good
Thank you.
afternoon. Natasha Petricola, Director with the Division of Senior and Adult Services. So Cleveland Wash House, Cleveland was bought out by Blue Heron. So that was one of the name changes. Same service, just a different LLC. And then the other one, the same thing, they had changed their name, and that was all. It's a matter of same service, just a different name change.
Thank you.
You're welcome.
Does the Director, does the insurance, other than changing their name, they have to change insurance and all that?
They met those requirements. There was no issues with that.
and any change in the number of contractors that we have, or the service providers?
We did have, is there one change? I think we lost one, and that was somebody who provided the homemaking and personal care because the organization kind of went defunct. They no longer are in business.
Okay, so all of these are still in the master contract. Are they, the amounts still kind of similar to what was in the last contract?
They're very similar to what we have based on the budget and allocating those funds accordingly. And there'll probably have to be potentially some adjustments made. Go ahead, Marcos.
So as you know, with a master contract, we move money around, and that's the purpose of it. So if one is underspending, we can move it to one that is overspending.
And Director, do you know how much the contract was increased?
We had several increases. There was one increase that was for $800,000. There was another increase early on provided, I believe council helped arrange that for an additional $400,000. We also took some of the money that was allocated for Mount Pleasant and the rent. I'm sorry, for the Hughes building and the rent, because we're not moving into 1801. We are in the Hughes building. Those funds, there was about $586,000 allocated for rent for 1801, and those funds were not necessarily needed. So some of that money was diverted into this program and our emergency dollar program.
In terms of options, have we lost any services? I know last time we spoke, there was a waiting list that was beginning to start, so.
There's still managed enrollment. If we lose a client in a particular area, we'll add a client that's on that managed enrollment list. We look at, obviously, acuity and need. And then we'll probably make some adjustments in the new year, looking at how many delivered meals there'll be per week. But nobody will go below 5 meals per week, regardless of what kind of adjustment we have to face and make based on the budget.
We were at 7 before? We're at-
There's a variety. There are some people who receive 7 meals, there are some who receive 14 meals, and there are some individuals who receive 5. Some of that's personal requests. Some of the older people do not need necessarily all those meals because of just eating habits. Others supplement because they're active with some of their senior centers and they get meals from other areas. So we try to tailor the plan to the individual.
Any questions from my colleagues? Anything else you'd like to share, Director?
No, we've moved, so if anyone wants to visit us, we're in
Yeah,
the Hughes building.
I learned about that today in Public Works.
We'll take you up
Should
on
have
it
known
and
beforehand.
keep up the good work.
And you need this when, Marcos?
We're okay
Second
with
reading.
No, we're okay with the 3 readings.
Right. Can I have a motion to move R2 025-0324 to the full council on the second reading?
So moved.
Moved by Castleberry, seconded by Hauser. All in favor, say aye.
Aye.
Thank you.
Okay, and right now, I apologize, but we're gonna give our next guest a few more minutes to get here. Kind of went quick today, because my colleagues didn't have questions. So we're on a break. All right, Madam Clerk, are you ready to read the item into the record?
Yes, Madam Chair.
All right.
Resolution 2025-0309, awarding a total sum not to exceed $15,000 to the Growing Right Over Wealth for the Mothers to Provider Safety and Compliance Access Project from the District 11 ARPA Community Grant Fund.
Welcome. So I just will give my spiel about ARPA. ARPA, and Dale's not here to give me the date. All ARPA applications go 3 readings, so there won't be any suspension. You're more than welcome to come back. Anybody have that date for me? When we will read it into the record for the 3rd time, provided through, and it should, hopefully, after your wonderful presentation. So welcome. So I'm believing that it should happen before the end of the year, right? Got enough? I'm thinking.
Madam Chair,
Yes.
Ben Schaefer, Executive Office. I believe that meeting is December 9th.
Okay, so that'll be the 3rd reading? All right, so we'll make it before everyone goes on a holiday. So, welcome, please state your name, and, Madam Clerk, if you could read that into the record real quick, or did you?
I just did.
Did,
Yes.
okay.
Thank
Go
you.
ahead.
Hi, my name is Ebony Spano. I'm the founder and executive director of GROW, Growing Right Over Wealth. I want to thank County Council for taking the time to speak with me. I know I've been before you many times before. I'm a little out of breath, sorry. Thank you all. So I will get started. As I've come to you before about caregivers and families, and more recently, in the past 3 months, there was a 5-year-old girl who was assaulted allegedly by 8, 9, and 10-year-old. I'm going to give you the background that I am allowed to speak about. That girl was laid in a field by herself for 2 hours unconscious. When they found her, no one knew how to do CPR, so they had to wait for 911. And as a mother, I couldn't imagine that. So, this is for Mothers to Provider Safety and Compliance Access Project. There are so many mothers who have children with disabilities, and they need to know CPR. They need to have that readily available. And currently, there has been a push of online CPR classes, and everyone here has been around before the golden age of the internet, and I think you all can attest and agree that CPR needs to be done hands-on. Okay, so I'm going to get started. Okay, I am requesting $15,000. The purpose is to build permanent live scan, CPR, and AED infrastructure to low-income mothers, kin caregivers, disability families, and job seekers. They can meet so they can meet background check and CPR standards. My immediate service area is District 11, where I'm a resident, but we will be tackling all of Cuyahoga County. Compliance costs are locking families out of work. So this is one of the tiers of why this is so imperative. You cannot be a home health aide or your child's paid provider unless you have a background check, CPR, and AED. And in the area that I've done the comps, that runs a mother about $75 for that background check and for the CPR classes and the renewal courses. And we can't stop finances from compliance and safety. Ohio's Bureau investigation process, 1 million background checks per year for schools, hospitals, daycare, and healthcare employers. These jobs cannot hire without current BCI and FBI scan and fingerprints. Over 70% of cardiac arrests happen at home, but Ohio's bystander CPR rate is only 34%, below the national average. So this is imperative, especially in Cuyahoga County, where we have a big aging population as well. I think we have one of the oldest counties in the state of Ohio. Without these compliance steps, mothers and kin caregivers cannot become paid waiver providers or take direct care jobs, which could really boost the social economics of Cuyahoga County, because again, you cannot be your child's paid provider without this, and you can work through an agency, so then it serves a dual purpose. And we also want to provide the social economic justice of these moms who may have just gotten their GED and they're trying to get back on track, and they cannot take that CNA course at Tri-C without this background check and CPR. So we're really trying to set mothers and other caregivers up for success, so that maybe they can get gainful employment and, provide care to someone else's family. So what I'm asking for is one mobile live scan system. And the reason I'm asking is for a mobile live scan system is, one, it is actually cheaper than the standalone that cannot be mobile. Two, that way I can service all over Cuyahoga County and go to these family caregivers to provide that, because some do not have the access to leave. They may have family members who are in wheelchairs and things of that. And this really is a 10 to 15-minute process. And as someone with a special needs child, I know how tedious it can be with any child, even my typical child, getting them ready and prepared to go out. And just for 15 minutes, I know a lot of mothers and caregivers, they don't see the benefit of it. And I'm asking for 2 CPR and AED training labs, 3 to 4 adults and 3 to 4 infant mannequins. More recently, we're asking for the infant mannequins because there are a lot of mothers who really just do not know how to provide CPR to an infant, and that is completely unacceptable, and we really need to close that gap. And how we will be providing this continuously so we never have to come back is we're gonna do a sliding scale based off your income level. So we will have an in-process operations specialist who will discuss and find out the person's income and how much we should charge them. Some of these mothers and caregivers, we're gonna be able to provide this service at zero cost, because what we're gonna do is we are going to charge the full price for people who do not need to be a caregiver. So that will sustain the costs for the caregivers. Year 1 results from a $15,000 ARPA investment, 200 background checks completed, 120 CPR AED certifications completed, 320 direct participants served, 200 live scan, 120 CPR, 800 plus family members indirectly impacted through safer, certified in-home care. And I think we all can agree, we live in Cleveland and we're gonna get 12 to 16 inches of snow. And we need to have caregivers prepare for that if they need be. And we can do that within a year. Job creation and workforce pipeline, like I spoke on, this is a social economic boost, right? I'm sure you've all been in positions where CPR was mandatory at a job. So, and we want to provide that for these caregivers, for these mothers. This lays the foundation for permanent self-sustaining employment pipeline, right? This may be an introduction to a mother becoming a nurse once her child is on track and she's able to get back into the workforce, which will boost the economy in Cuyahoga County. And I will have a program coordinator and 2 CPR instructors that are part-time. And the supports, we will be making it accessible for mothers to become Medicaid waiver providers, home health aides and personal care aides, child care staff and teen caregivers, disability service agencies and group homes. That is another big factor, especially in the inner city ring. There are a lot of children that are babysitting younger siblings. So we are also providing these sliding scales CPR classes for those preteen teenagers that may have to watch a younger sibling while their mother goes to the grocery store. Live Scan replaces paper fingerprint cards and ink and mailing with secure digital submissions. Especially in this age, we want to keep everybody's personal information safe. So that's why Live Scan is important. The CPR equipment is reusable. We clean it off, we'll sanitize it, and use it again and again. The equipment has a 5 to 7 year lifespan. By that time, we will have quadrupled the amount of caregivers and providers that we can provide a background check and CPR training to. This is the budget of how the money would be allocated if we are granted. The mobile live scan system is $9,800. It will be $3,000 for the CPR AED training equipment, 3 to 4 adult mannequins, and 3 to 4 infant mannequins. Again, we want mothers of children of all ages to feel safe and be able to provide CPR and AED training. Thank you, County Council, for your time, and I appreciate everything you guys are doing here. This project removes compliance barriers for COVID-impacted caregivers. It strengthens the caregiver and waiver workforce for elders and people with disabilities. It expands access to background checks and CPR in District 11 and Cuyahoga County. It creates self-sustaining infrastructure with a 5 to 7 year lifespan from a one-time ARPA investment. We appreciate your consideration and your ongoing commitment to Cuyahoga County's families, caregivers, and vulnerable residents. Thank you.
I'm going to open up for questions from my colleagues. Councilman Schlepper.
Hi, Ms. Spano. How are you?
Good, how are you today? I
Good.
love your sweater.
Thank you. Appreciate that. I've been calling it my house coat. Thank you so much for being here. It's interesting the little swaths that we find of need that we may not think about. So I really appreciate you bringing this to light. This is near and dear to my heart as somebody that, I've said this a million times, has adopted a child through the foster care system. I had to go through CPR training, be medically trained, and even if my family was open to taking a medically fragile child or whatever that might look like. But I remember it was a nightmare. It was a nightmare when I lived in Colorado. It was a nightmare when we came here and decided to go through the process because there was only paper pieces that you had to do. I had to go to the local police station. We had to coordinate and figure out how to get there with a child in tow, all the pieces. And then there was a cost. We were, of course, able to absorb it, but not everybody is. And I think that when you consider, when you go through the foster care system, the training that's involved, CPR, and then every other parenting course, it took us 6 months to go through that program. Every Saturday for 6 months, we went through that. There's a piece of me that thinks every parent should go through that because in a way, we were kind of ready to roll when the time came. But having experienced some of this, the fact that this is a digital piece, the fact that this can happen same day and get the results that are needed, to allow things to move, to expedite things, I think this is a great tool. So thank you for the work that you do. Thank you for bringing this to the table. And again, I think about how this has the potential to save lives, specifically children, because there is this window, even something as simple as a child choking. And if someone does not know how to do the appropriate CPR, the appropriate maneuvers, we know the results, right? Same thing with when I think about children that, infants, right? It's very specific, CPR or choking or what those look like for an infant as opposed to a 4-year-old, as opposed to a 20-year-old, right? So the nuance here, and I think this is certainly something that's very sustainable as well. So I am in full support of this, and I appreciate you being here today.
Thank you, I appreciate that.
You can go, then I'll go. You go, okay, thanks.
Castleberry.
Thank you for your presentation. One thing I wanted to ask you about, as far as the specifics, I think it's a great program, but I want to see it said up to 5 rotating outreach workers or community ambassadors. Are those ambassadors, are they a paid employer? These are people
So
volunteer, how's that work?
these are going to be volunteers.
Volunteers.
Yeah,
okay.
these are volunteers, and we're going to use a pay it forward system. We're going to have, if you come and you can be provided the service for free, we're going to ask you to do that marketing, tell a friend. A lot of moms and a lot of caregivers, they know other caregivers. Okay. So it's going to be a pay it forward. You did this, can you let someone else know it? I think that is the biggest marketing tool. I remember in undergrad, that was the biggest marketing tool is word of mouth. So that's these ambassadors, they will actually rotate because we want to make sure that we're getting the word out there.
Understood. Yeah, I saw that about the rotating. That's why I thought maybe, and Ambassador, I'm thinking volunteer, but I
Yep.
wasn't sure how that was working.
Yes, we
so-
want to use a pay-it-forward system. We want to make sure that we're, hey, we helped you, can you help another mom?
Yeah, I got you. I like it. Thank you.
Councilman Sweeney?
Thank you, Madam Chairwoman. Welcome.
Hi.
I'm,
I like your blue shirt.
that was a sympathy blue shirt.
Yeah, I got that.
I got
Oh, no, I love your haircut.
I love his hair. Like, we don't get these. You got game.
Thank you.
I don't know if that was appropriate, but I think it was taken.
It's okay.
It was
You got
delivered
it.
that way. Oh, my God. This is not working. I know firsthand about, I'm a direct service provider for Gary.
Oh, okay.
And I had to do the CPR, I had to do the background check, the fingerprints, and it's just such a rewarding opportunity, but you have to go through all that. And through the chair, the cool thing about it, once you have the mannequins, you're going to be a junior Red Cross. Because everybody wants, I call up, it's 3 weeks away, and there's only 10 in a class. If you're not here in 15 minutes before, they're going to close the door, you can't get in. Once that word on the mouth, you're going to be,
I know.
that's not going to be
I'm
bad.
very good. That's why I'm only asking for a one-time fee.
Yeah, 75, 75, 75, 75. So I like it. So that's your sustainable model.
Thank you.
And would you mind if I added 5,000 just to?
You know what? I really like your haircut and your beard too. You know what I mean? Thank you.
Now you got to go to confession if you're Catholic, because this is scraggly looking like Santa Claus on December 7th.
It's the season.
I'm going to be Santa Claus on December 7th, so that's why I'm looking like
Look, it's
this.
the season, and you're going to be a great Santa.
I'm just going to give you, I'm going to ask my colleagues to consider adding $5,000 because of the wonderful work that you do and how
Thank you.
important this work is.
Thank you.
And getting the folks that care the most to be able to do the job when money was the barrier from them having the ability to, or they have the ability, but have the option or opportunity to. Because there's not many folks in the world that want to do this. And if dollars are the problem, it's just sad that that
Very.
skill set can't be matched with the population that needs it. So do get serious once in a while, continue your good work, and this presentation was knocked out of the park. Thank you for taking the time to do that.
Thank you so
Madam
much.
Chairwoman.
Okay. Ms. Bano, will you keep records of who has taken the courses? Will that be part of the?
Yes, ma'am. We have we're going to do an intake for everyone because, again, we're going to have a mailing list through Constant Content. So we will let these caregivers know via email when they're about to expire so we can get them in the class back again before it expires.
Okay, and how will, I know you touched on it a little bit, and my question was, how will parents find out about this? And you kind of said word of mouth.
Well, I'm also going to be doing marketing myself. I've actually been planning on this for the past 90 days. I have about 10 home health aid companies, and I will be going to low-income housing, partnering with their service coordinators to let them know. And again, that's why the ambassadors are in place. They will be given stipends through other grant funding to drive to facilities and places to give out the marketing material.
And can you also share this information with Cuyahoga County Board of Developmental Disabilities? Maybe they can help market this. I
Yes.
think that was maybe one of your initial thoughts was
Yes.
to make sure that those parents.
I have a meeting with them next week.
Okay, very good, very good. And I see that your focus is primarily on District 11, but I think somewhere in the presentation, you stated that you were going to kind of try to do this.
Well, legally, the Attorney General for the state of Ohio, for a live scan equipment, you have to have a physical address. That is the state requirement. So I have a physical business address donated to me by a good friend of mine, an office in South Euclid. But that's why we're getting the mobile equipment so that we can service all of Cuyahoga County. But legally, we have to have a physical address that's a building.
Okay, so, do you think there will, in your documentation, you'll kind of, I guess you will, but it doesn't have to be necessarily district-driven. Just, I guess.
It's not. I just have to put that in there because the state laws, I have to physically say, hey, we are planted here. Even though this is mobile, this is our physical location. It's a nuance, but
Well, I'd like to add 5,000 as well. More parents that can.
you are amazing and I love that blazer. It matches your glasses.
Don't have to. I'm good. I know I'm looking good. I'm just gonna say that.
I don't have any money, so I won't.
So, any other further questions or anything?
And that funding that you guys are adding, I can use that for the marketing as well. In the constant content email, like I said, that's how we're going to recertify moms and let them know that, hey, your recertification is up, time to come back again for your free CPR classes.
Okay. So hopefully the additional funds will assist more parents that don't have the 75 or the cost. So anything else from my colleagues? Any other questions? Anything? When did you plan on implementing this? I guess that's a big
January
question.
2026. I have the plan ready, I have the office, I have the CPR instructor, who is a former EMS for the city of Cleveland. I will also be providing CPR classes. The CPR instructor is also bilingual, Spanish speaking, so we're gonna cover a lot of territory.
In the, I know this is not initially my ARPA thing, but I have always requested in this committee to come back and do a report within a year or whatever, give you time to get it implemented and started, just to share with us how it's been going and everything like that. So hopefully you'll be in agreement to that.
I look forward to that, of course.
Madam Chair, one quick question.
Yes.
And, if you know the
Congratulations to your daughter for graduating law school. See?
Thank you.
I didn't forget about you.
No, she's, yeah, appreciate that. This is-
did your homework?
Yeah.
She knows Facebook. But do you know if you need to be certified by the BCI to operate the live scan?
You do not.
You do not.
You do have a course that you need to take to learn how to use the software. They will provide the equipment and the laptop and the system to make sure that it is secure.
Great, thank you. You got them all covered.
I think we'll probably, well, I know you're doing mobile, but if you ever have a class,
Well, that's the reason why the mobile live scan is for, it's cheaper, it's flexible, and we want to be able to go to caregivers. And we're actually, the business model sets it up that in 6 months, we can buy more equipment. We are going to have 3 to 4 locations in Cuyahoga County in the next 3 to 5 years to ensure the safety of our county.
I'd like to come when,
I would love for the county to be a vendor and do all you guys' CPR classes.
right. So, as I stated earlier, 3 readings by December 9th. If everything goes well, once we pass it out of this committee to the full council, it should be going for its 3rd reading on December 9th. So I'll make a motion to, and add my name, please, Sharon, R2025-0309. Is there a second?
Second.
Moved by Conwell, seconded by Castleberry. All in favor, please say aye.
Aye. Please add my name if you don't mind, Madam Chairwoman.
Castleberry as well, please.
Whole committee, all right. So, we've all moved this to the full council on, 2nd reading. Anything else for the good of the whole? Hearing none, this meeting is adjourned.
Thank you.